Good evening, all. Myself, Maneka. I am a HR advisor in the UAE healthcare industry, almost 2 decades, handling multiple roles in the HR. I passionately talk about people and culture, talent management, recruitment strategies. I'm a certified life coach and an NLP practitioner. If you're a healthcare professional looking to work in Dubai, you have picked great time to do so as your skills are wanted by hundreds of facilities. However, if you're on the hiring side, it is crucial to employ targeted healthcare recruitment strategies to attract top quality candidates. So in this webinar, I aim to equip you with the tools and knowledge needed for effective healthcare recruitment in the UAE. Let's move to next slide. Here we are talking about the healthcare hiring key areas. Your first steps should involve understanding the market conditions and your specific needs as an employer. Figuring out where to begin can be challenging. Think about what role this new individual will need to take on, what you expect to come out of this recruitment process, your hiring time frame, and your budget constraints. A thorough understanding about your competitors and landscape, especially in the UAE healthcare market, where competition and the need to attract staff is tough. Moreover, the UAE healthcare sector invests more into developing world-class healthcare and medical facilities. The demand for staff is also rapidly increasing. Hence, identify the right candidate and initiate the hiring process. So here recruitment as a framework helps organizations source, attract, and retain top talent who fit the organization culture, can add a lot of value, and help the business meet its long-term goals. It requires a lot of planning, strategy, evaluation, analysis, and marketing. Let's move to the next slide, and we talk about what is talent acquisition. Here, talent acquisition is actually a strategy used in recruitment that focuses on finding, attracting, hiring, and retaining top talents inside an organization. In other words, it's a planned and structured complex of actions the HR department must do to get the best employees. It requires a lot of planning, strategy, evaluation, analysis, and marketing. So, what is happening in the today's hiring procedure? When we look into the previous hiring tactics, there are a lot of difference in the years actually. Today's hiring process is very different from what it was 10 years ago. Even procedures developed 2 years ago still require improvement. Because of this, it is critical to evaluate your current procedure and implement cutting edge recruitment tactics. By doing this, you will find qualified individuals who are both good for you, patients, and a good fit for your business. So let's move to next slide and talk about what is actually talent acquisition. So here talent acquisition, when we look at as a whole, there is a close correlation between the business strategy and the business results. There are a lot of parameters which you need to be considered while during the time of the recruitment, where it starts from the planning and strategy, the recruitment, the advisory, employment branding, outsourcing, tools and technology, metrics analytics, talent segmentation, compliance, and process excellence. All these parameters you need to keep in mind very thoroughly with a clear understanding to get you a better talent results end of the day, which gives you a business results. So when we talk about the landscape of the talent acquisition in the healthcare industry is continuously evolving, and healthcare facilities must adapt to new realities to effectively meet their staffing needs. One strategy that has gained prominence in recent years is partnering with healthcare staffing agencies. In this webinar post, we will also explore the changing landscape of talent acquisition in healthcare and discuss the benefits of leveraging healthcare staffing agencies for improved recruitment outcomes. Okay, so what are your primary goals? Let's move to the next slide. Potential employees might think your business is outdated if you haven't updated your brand in a while, as you have difficulty finding the right candidates who are enthusiastic about your practice. This can damage your reputation and prolong the hiring process. Review your benefits and compensation package. There are currently more open procedures than qualified candidates, which is a minor crisis for the healthcare sector. As a result, hiring has grown extremely competitive. Improve the recruitment process. You can use a hiring a clear, streamlined process that works for your practice by taking a close look at it, identifying areas where you can make improvements, and then making those damn changes. That covers very detail from the application process to the types of questions you ask during the time of interview. That makes the hiring procedure reflects your brand. So always keep in your mind that your brand extends across channels, including your website, social media accounts, and even the decor of your waiting area. Candidates should see the same message everywhere they turn. And when you review your benefits and the compensation package, we can look into in different angle. And whatever you like it or not, you need to provide benefits that are more alluring than those for your rivals. However, it does not mean that you need to pay the person the highest wage. Check and they do a cross comparison with the market updates and include in your policy. Be openly discuss with your management as a talent acquisition leader, discuss with the CEOs, the finance leaders, and find out a better hiring process when you look into the brand as such. Hence, it is necessary that your culture reflects your values and invites people to work for you. The best healthcare consulting companies in Dubai can assist you by making you aware of cultural differences and getting the right team for your company. Do a thorough market survey, do a cross comparison with your company to other. You will get a better idea how to close the positions very closely. So let's move to next slide and we'll talk about what are the more points which we need to look into. You publish your vacancies in job boards. You can find nurses, doctors, and other candidates. Practice by going directly to the source by learning with job posting are well known in the healthcare sector. Discover how you can enhance your hiring process by seeing things firsthand. It's no longer sufficient to simply post a job opening and wait for the upsurge of applicants. You might receive a torrent of applications. You will get irrelevant job CVs as well towards the postings. But the caliber of those applicants will range from excessive to unsatisfactory. You can find nurses, doctors, and other candidates for your practice by going directly to the source by learning which job postings are well known in the healthcare sector. When developing a recruitment and selection process, internal factors are one of the most frequently ignored areas. So look within your team. Your staff is active in a number of communities and groups that you might not be even aware of or have access to. You can expand your audience and give your team and liberty to brag about continuing to work for you by speaking with them about available positions and asking them to share and introduce. So better introduce a good referral program. This can be a good strategy to get good number of nurses towards the open vacancies. So you openly communicate with your colleagues, team members, and this will be a very good media to help and close the positions on time. So let's move to the next diagram. Yeah. So what does the current survey talk about? What is the status of the UAE healthcare sector that projected to grow to AED 39.4 billion by 2023? So this means revenue generated from sales within the UAE healthcare sector is forecast to grow at a compound annual growth rate, that is CAGR of 7.5% over the next 5 years to reach 39.4 billion. That is in 2021, according to new analysis from Dubai Chamber of Commerce and Industry predicts based on data from Euromonitor. So the sector is really says that there is a lot of opportunities for the healthcare workers in the UAE market. So, healthcare expenditure will likely see significant growth in the UAE and worldwide in 2021 as additional resources are required to reboot infrastructure for the return of elective procedures following temporary suspension of these services due to COVID-19 selective restrictions. So post-COVID era, what is the next status? It is worth noting that several healthcare service providers in UAE reacted quickly by providing telehealth services to patients during the lockdown. Lifestyle disorders, aging population, and rising demand for personalized patient care, as well as the self-health management tools, will continue to drive the telehealth market in the UAE. Besides, telehealth in medical tourism may improve the process and quality of pre and post operative care. So, altogether, UAE is coming up with a lot of infrastructure developments, and that will accelerate a rebound in medical tourism and attract international visitors to Dubai who are seeking treatment, the analysis has noted. These efforts should result a positive impact on medical tourism in the country, which are projected to reach by CAGR of 17.1% between 2021 and 2025. So altogether, when we say the UAE healthcare market is given a lot of opportunity for the new healthcare professionals to come and grab the opportunities. So let's move to the next slide and talk about the landscape of talent acquisition in the healthcare industry. So what exactly as such, what is the reason of the growing demand? How to explore this? So growing demand for the healthcare professionals is on the rise, driven by factors such as aging, population, advancements in medical technology, and increased access to healthcare services. Healthcare facilities often need help to meet this demand and face challenges in sourcing, attracting, and hiring qualified candidates. In-depth industry knowledge and understand the specific skills, qualifications, and experience required for different roles. Recruiters should be talented in the sourcing the apt candidates towards the vacancies. A skilled recruiter plays a vital role in closing the positions by doing the headhunt and keep proper manpower planning towards the vacancies. So, how about the navigation, which we talk about, and it is in turn the growing demand for healthcare professionals. So, partnering the healthcare staffing agencies can provide access to a broader talent pool, and they elevate the recruitment burden and tap into specialized expertise. So that can be done in identifying the recruiting professionals across various healthcare disciplines. They have in-depth industry knowledge and understand the specific skills, qualifications, and experience required for different roles. By partnering with these agencies, healthcare facilities can tap into their expertise and ensure a more efficient and targeted recruitment process. So, what are the fluctuations in patient volumes, seasonal demands, or unexpected staffing gaps? Whether it is the short-term assignments, temporary placements, or permanent hires, proper understanding the current needs and trends is very much required when we do the talent acquisition. And then we also look into the streamlining the recruitment process. Recruiting healthcare professionals involves extensive process. You need to find the right candidate, sourcing, resume screening, interviewing. It's a total gamut to close a position. You need to have a clear tactics while we hire a right candidate. So establish systems and resources to streamline these processes efficiently. They can pre-screen candidates, conduct thorough background checks, and verify licenses and certifications, saving time and effort for healthcare facilities. So, as the talent acquisition landscape in healthcare continues to evolve, healthcare facilities must adapt to new realities to overcome recruitment challenges. The facilities can enhance their talent acquisition strategies and effectively meet the staffing needs of a changing healthcare landscape. So, we will talk about the difference between talent acquisition versus recruitment in the next slide. Let's move on. Here, when we talk about what is the difference between talent acquisition and recruitment, so a proper talent acquisition head and a recruiter need to understand what is the difference between these two parameters. So recruitment tends to be reactive and is component of the larger talent acquisition process. When you are trying to find candidates to fill a vacancy or identify the best applicant for a role, you are recruiting. And when you look into the talent acquisition, it's proactive and involves planning. It's less about quickly filling a gap and more about bringing the specialities, leaders, innovators needed to publish your organization forward. Every networking event is an opportunity for you to share your company's story and meet and attract potential candidates. So in short, the difference between recruiting and talent acquisition is short-term execution versus long-term planning. When you recruit, you are often reacting to an immediate need, focusing on finding talent to fill an opening rather than accessing a candidate's fit with your company's broader vision. So there is a good clarity among these two points to go further in the latest technologies of healthcare hiring. Even if someone is not right fit for your company's need now, that doesn't mean that they won't be in the future. So that person can be fit in the future roles. When you're reviewing the established talent pool, remember that you're advertising your company and people will share their experience with others. The candidate is your word of mouth, actually. So, even if you decide not to hire a candidate, be sure to treat them with dignity, reaching out to them after the networking event, no matter the final hiring decision. You can always have a template message ready to send to the applicants, thanking them for their time. As a talent acquisition specialist, your every move gives people a story to tell. And it is a branding. It showcases your company. It is your face, your offer of your organization. So talent acquisition specialist plays a vital role in any of the organization for insert in terms of the branding. In short, our recruitment team can put in the time to find the right person for the job and make sure they fit for the company culture. But it can be a short term solution. While you hire may be perfect for your immediate vacancy, their skill set may not align with your company's long term plan for growth and overall version. So, in the next slide, we will talk about the measures to be taken for the talent management. The critical role of management and leadership in facilitating talent management and highlighted the need for employee encouragement, motivation, and engagement. Furthermore, there is a need for intensive teaching of the hospital employees about industry and providing them with the relevant skills and competencies. Organizations should develop their talents that fit in with their culture, resources, and business accordingly to build talent management policy and strategies for the UAE hospital. Implementing a new talent management strategy could fill the gaps, clears ambiguity and fuzziness about talent management, attract talents, and provide human resource with special skills required for the hospital, and align the UAE hospital strategy with the country's Emiratization national employment strategy. So all these measures to be taken when we do a talent management. So let's discuss in the next slide what are the strategies for healthcare recruitment. So when we talk about these strategies for the healthcare recruitment, there are challenges as well as the strategies. So what are your challenges actually? So, budget constraints can occur more frequently in healthcare recruitment processes and can make the task of finding good candidates are more challenging. Regulatory compliance presents too much challenges in the healthcare recruitment process. And when you talk about the meeting deadlines, it is time bound, identifying the right fit, and hiring the diversified candidates. So all these are your challenges. So keep your eyes open and see how we can move forward as a good recruiter. So when we talk about the restricted funds, that restricted funds may prevent investment in job portals, advertising, and technology needed to effectively market job openings. If you work within the UAE healthcare industry, then you already will know what a diverse, advanced, and expanding sector it is becoming. The country invests more and into developing world-class healthcare and medical facilities. The demand for staff is also rapidly increasing. So the position is very crucial. And if you're not finding a proper right fit, you always do the job post and make your finances convinced and get a bit relaxation in your budget so that posting will help you get your placements. You will be able to find the right candidates also for the interviews. And when we talk about the regulatory hurdles and how to avoid them, see, it's not like country to country, all the regulatory compliance are different, labor laws are different. And when we move a particular candidate from their hometown to work in UAE sector, there are different compliance processes which we always need to go through. So it's like one is the licensing, And the certifications, visa requirements cannot only slow down the hiring process, but also lead to costly legal issues if it is overlooked. Moreover, understanding visa categories and their implications is another layer of complexity. Employers must be aware of the visa status of expat candidates, as each type comes with its own employment limitations and requirements. So, ignorance in this area can lead to delays and potential legal consequences, including fines and revocation of licenses. So, as a healthcare recruiter, you should be very sensible, thorough about the legal compliances, and do the recruitment. Then we talk about the time sensitivity of hiring. So meeting the deadlines without compromising the quality. Always look for the quality. It talks about you after you do a proper placement. You will get a satisfaction when if you're not compromising the quality. The need of quickly onboard new staffs may conflict with the notice periods. Qualified candidates must serve their current organization. They need to submit the notice period. This leaves you with a dilemma. Hiring often brings regulatory considerations into play. All these makes a recruitment team a bit strained. So when we talk about the talent acquisition and the recruitment, it is a time tedious task, and you need to follow a very systematic approach. So what are your strategies to overcome all these challenges? Through a proper in-house referral program, and effective ways to quickly source the perfect candidates over referral programs with incentives. So through referral programs, your current employees can leverage their networks to refer potential candidates for open positions. This approach is often effective for multiple reasons. First, your existing employees, they are already familiar with the company culture and job requirements, are more likely to refer individuals who would be a good fit for the role. They are being in your system for quite some time. So the existing employees knows what the company actually is. So the internal referral program is very much helpful for closing a position. Additionally, since an employee's reputation is at stake when making a referral, they are likely to recommend only highly qualified candidates. So employee referral programs not only save you money on recruitment, but also significantly shortens the time needed to fill a position. So utilize that area effectively. Maintain good communication with staff. They are known to increase the employer's retention. Then we talk about the existing employees. Actually, they are, again, I'm telling you, they are the word of mouth of your company. So make a good rapport with your existing team members and the staff who are working in your hospital or in your clinic. Additionally, offer a tangible incentives such as cash prize to employees who successfully refer a candidate who then passes their probation period. So all these parameters will help you to close a position. Networking, getting connected, engage with career fair, events, etc. So all these are other parameters which you can always explore. When we talk about the networking, it's a powerful tool for the healthcare recruitment, and its impact should not be underestimated when compared to other hiring strategies. Attending industry-specific events and networking sessions can serve a dual purpose. They not only offer the chance to find your next available team member, it's actually giving you to increase your networking connections. And then when we conduct the career fairs, university events, and similar gatherings within the UAE healthcare sector offer prime opportunities to identify potential candidates while also enhancing your company's reputation. It's a matter of branding that will gauge your company as well when we conduct the university career phase. The United Arab Emirates is currently making significant investments in medical education and training facilities, aiming to attract and retain medical talent locally. So conducting career fairs in the university events is a great approach. Please try to explore. Building talent pool database. So we need to have a very strong database to close the positions. This will help you to find a specialized category of doctors like interventional cardiologists, laparoscopic skill consultants, bariatric surgeons, stroke medicines, qualified consultants like CCT Fellowship, European Board, Western or Eastern educated professionals. So make a good talent pool with your database. Your database should be ready, and the pipeline candidates needs to be there to fill the positions whenever there is a need. Then what do you think about the effective head-on top healthcare professionals? So here in this area, the recruiter should be very understanding, and they need to know how to close the positions correctly, and the headhunt really plays a vital role. So headhunt the top healthcare professionals. Specialized tactics are essential. One such strategy involves leveraging digital platforms like LinkedIn. By utilizing its advanced search features, you can identify and reach out to candidates that precisely fit your criteria, even there are no current job openings. This proactive approach keep your talent pipeline robust. Also consider consulting professional recruiters with your network for referrals. So there are different medias are there. Keep your eyes open and enhance your connections through the networking, do the headhunting, and keep your talent pool ready all the time. So these are the areas where, as a recruiter and as a talent acquisition specialist, uh, you how you can build your database. And there is another effective approach for keeping your database: quality candidates. You can access it when it comes to filling a healthcare position quickly and effectively. Keep your database very strong, and nurturing potential future candidates will also increase the size of your talent pool. Do the succession planning, sit with your team members, sit with your department heads, and nurture the potential future candidates. It can happen only through the succession planning. Then, how we can improve our recruitment tools through the HR digitalization process. There are different type of tools are available in the IT recruitment that helps you quickly screen potential candidates as well as track and keep a hold of your previously rejected candidates who might be a good fit for a different role. You can even flag future applicants, create an up-to-date and organized interview schedule, send out automated responses to candidates, and stay in touch with the potential hires. So all these, with the help of the latest IT technology and which are available in the HR digitalization platform, utilize those features which help you to reduce your time you're spending during the time of the recruitment and the hiring and the onboarding. So implement the best IT technology in your company. This can be done with a close interaction with the CEOs as well as the financial heads. And emphasize diversity in the hiring. So, when we talk about the diversity in the hiring, bringing experience and skills from around the world, the UAE is made up of over 80% expats, and this is mirrored healthcare industry. So if you wanted to have a better, outstanding face in the healthcare industry, you need to have and hire good experienced professionals who are from different countries. So it is vital to make sure that cultural diversity is represented in your organization too. As you will be likely employing a range of cultures, you need to ensure that the new staff you hire are aware of this and would work well in this environment. So, whenever you hire a new talent pool from the outside country, have a good plan and hold the new staff, because they are coming from different country to UAE, and that too in your company with different culture. So handhold that employee very nicely to get a good retention. So let's move to the next slide, and we will talk about the rewarding career. Shifting to the UAE for a rewarding career in the growing healthcare industry. The healthcare industry in the UAE is rapidly growing and evolving. This means there are adequate opportunities for deserving candidates. If you are a nurse, doctor, or technician looking for professional opportunity in a foreign country, several available reasons make the UAE as a great choice. There are different methods for you to stand out among the other candidates while shortlisting the CVs. In the UAE healthcare industry, majority of the workforce, per se, nursing and paramedic departments, staffs are representing from India, Philippines, and Pakistan. So, as a candidate, when you look for a relocation from your home country, understand eligibility based on Emirates and the requirements for the healthcare jobs in the UAE. So, why the shifting to UAE is a rewarding one? Because it's tax-free income, multicultural workforce, world-class infrastructure, great quality of living, safety and security. So just like other countries, there are some challenges of shifting and living in the UAE. But as long as you're eligible, hardworking, open to changes, and working with a reputable a reputable employment consultant, you are bound to succeed in the thriving healthcare industry of the UAE. So let's move to the next slide, how we can do and have a systematic approach to get a job in the UAE industry. So there are a few parameters which you can keep in your mind. Firstly, you need to clear DHA, MOH, or DHA eligibility. That is depends upon each and every emirate. There are different rules and regulations. So healthcare licensing procedures are different. Mainly, if you wanted to move to Dubai, you need to clear the DHA. All the Northern Emirates are with MOH, and Alain and Abu Dhabi are with DOH. So plan which emirate you wanted to move on, and then you clear the eligibility. That means licensing process. Submit the job applications. The third point is provide OET training. So here, when you are moving to a different country. So here in this UAE, everyone speaks English as it's the most common language in the city. But it is always good, you should sharpen your English language. Vocabulary is a must. And then fourth point, valid BLS, ACLS, PALS certificates, which needs to be valid that based upon your job role. Improve your soft skills. So it is another personality development which helps you to polish soft skills and attend personality development sessions, which gives you a great face when you appear for an interview. Then regarding your certificates, diploma, bachelor's, or any education certificates, make sure it has to be attested from your country before you come to UAE. Attestation is a must for processing the employment visa. Target to land jobs at hospitals and healthcare facilities. So keep all these points in your mind to give you better opportunities and grab it when you are landing in UAE. So why I emphasize in the English speaking skills is, if it is not strong enough, you need to consider sharpening it in the speaking, writing, and reading. So I recommend strong English as one of the biggest features you should have if you're moving to Dubai to work, as we cater multicultural, diversified nationals. And then regarding your BLS, ACLS, please approach a better authorized center. They will guide you to get BLS, ACLS, and PALS certificates. Let's move to the next slide. So when we talk about the healthcare recruitment, it is important to remember that while you are evaluating candidates based on their experience, they're also assessing your organization. Prospective employees are looking for signs that the company treats its staff well, offers competitive benefits, and is committed to community well-being. So as Dave Bookbinder narrates, people are an organization's most valuable asset and the key to success. So I personally appreciate Mr. Sham from Medfen to arrange this webinar and his initiative to conduct an awareness program in healthcare recruitment. Thank you so much.